The Canadian Pediatric Society is warning about the effects of medicinal marijuana on children. It says evidence is lacking about benefits of medical marijuana for kids, and doctors who do administer it should have specific expertise and training. Joining us from London, Ontario is the author of the statement and chair of the Canadian Pediatric Society's Drug Therapy Committee, Dr. Michael Rieder. Good morning.
Good morning.
So, Dr. Rieder, tell me a little bit about what the concern is on behalf of pediatricians, because we know, certainly anecdotally, that there have been a number of children who have benefited from medicinal marijuana in cases of epilepsy. What's the main concern with this?
Well, that's a good question. I think, first of all, we know that, I think part of the issue is that is the idea that marijuana certainly has become much more popular as considered to be an option. And there's no question that marijuana is a potent psychoactive compound. It contains a bunch of different compounds, that some of which appear to be beneficial for cases of epilepsy. You know, if you compare things over the last 5 years, there's been a certain increase in interest in it, in medical marijuana generally. I think the issue with seizures, as brought into place by Charlotte Figi and of course, Charlotte's Web, the preparation made down in Colorado.
Yes.
And while there's no question that for people like Charlotte Figi, who has a very bad form of epilepsy called Dravet syndrome, that it did appear to decrease frequency of seizures, there's also been troubling research coming out about potential adverse effects. So like any potent psychoactive drug, we think that we need to balance risk versus benefit, make sure that children who can get the benefit at the same time acknowledging the risk.
So what about the actual research behind what, you know, the medicinal qualities for marijuana are in terms of being able to help people, the actual evidence?
Well, the actual evidence, to be honest, is pretty scant. I mean, if you look at the evidence of marijuana use in seizures, there's a very small number of well-controlled studies looking at it. The number of patients is less than 100 who've been actually well-studied for respect to efficacy in seizures. There are anecdotal reports. And I think, for instance, for children like Charlotte Figi, who has a rare form of epilepsy, there is the anecdotal evidence that seems to help in her case, but there are none of the large systematic studies that we like to see in terms of categorizing risk and benefit across large groups of patients.
So tell me about, you know, the risk involved. I mean, okay, so there's the anecdotal benefit anyway, but what about the risk?
Well, I think, first of all, I think that there's this kind of a mystique attached to marijuana that it's natural and therefore safe, and I think we have to acknowledge marijuana is a potent psychoactive compound, and I have a lot of respect for it because there's certainly, it does seem to have some beneficial effects, but there are risks attached to it. There's some troubling work coming out of Harvard, for instance, and some of the British work, suggesting that marijuana use during adolescence can change the way the brain develops. And there's some work out of the UK suggesting that there's a significant increase in risk for psychosis. So if you're someone like Charlotte Figi who's having 50 to 60 seizures a day, then you balance the risk and say, yes, there may be risk, but there's certainly benefit. If your condition is less severe, you may think, well, is the risk actually worth the benefit?
So it's really a call to awareness, if not action, on behalf of pediatricians then.
Absolutely, and I think also it's a call for more research, because one of the problems we have right now for medical marijuana is, until recently in Canada, the only way you could get it was by smoking, which is a terrible way to give a drug, period, full stop. Now the Supreme Court decision has opened up other routes, but I think we want to be able to, if you're going to use a drug properly, you need to know the right dose, how often to give it, what to look out for side effects. So I think there's a lot of work that still needs to be done.
Well, Dr. Michael Rieder, certainly appreciate your time talking to us about this. Thank you.
Thank you very much. You have a good day.